Hi, hello everyone. I'm back again, Dr. Saru, and today our topic is going to be fertility control, or in other words, you could say contraceptives. So, what is contraception? It's methods that you could use, be it using pills or injections or the many methods that I'll be talking to you about today, of trying not to get pregnant, period. So there are permanent methods and there are temporary methods. But so we know what contraception is, trying not to get pregnant in simple terms. Let's come about and talk about what is an ideal contraceptive. According to you, what would you want to be an ideal contraceptive? So these are some of the points that have been brought up to be an ideal contraceptive. An ideal contraceptive, one, should be cheap. Two, readily available. You want it, you can get it. It's pocket friendly, something you could just get very fast if you even have a few coins. The other thing, it should be very not permanent, in a way that in case you want to get a baby or you want to conceive, then it has to bring problems. So you should be able to be, I'm trying to get the word but it's not coming right now. So the thing is, in case you want to get pregnant, immediately you stop, you should be able to get pregnant immediately. That is one of the factors of an ideal contraceptive. Another thing, you'd want it to do just the work it's supposed to do, not extra works. Or if it has to do extra works, then they need to be positive things. So you'd say, let's do the fourth one, extra positive factors, which we'll discuss later. So, and then the other thing you'd want from an ideal contraceptive is it's readily available, it's cheap, it does not prevent you from getting pregnant whenever you want in case you stop it, and other factors which we'll continue talking about on the same point of ideal contraceptives. So let's move to the next thing. Then the types of contraceptions. Types. As I told you already earlier, so the types I'd said earlier, there's permanent and temporary. So before I come to the types, I would love to finish the ideal contraceptives before we go any further. So as I told you, cheap, readily available, extra positive factors, or you could just say non-contraceptive benefits, which I told you I'll talk about it later. The other thing, it should be acceptable to all cultures and religion. The other thing, you should be able to be independent of intercourse. Let's take for example condoms. You use them during the time, it could be very inconveniencing at time, caught in the heat of the moment. So it should be independent of intercourse, like it doesn't interrupt the whole situation when it started, and plus the intercourse is independent. And the other thing, you don't need a healthcare provider or specialized personnel to help you with the procedure of using them, or how to put them, how to use them. Something that you could use yourself without having to, such as the coil and stuff like that, which you need somebody who's trained to actually do it for you. So let's come back here to the types. So for the permanent, for the male, we have vasectomy. I know you're surprised, but yes, it's a means of fertility control. It's one of the contraceptives. It's not really a contraceptive, but that's why I said fertility control stroke contraceptives. So Vasectomy is for men. For women, we have multiple choices. There is tube ligation. You could either ligate your tube, you could either get them cut. So what I mean by tube ligation, this is the tube, the ovary. There's either clipping, you could be clipped, or you could be ligated. Ligation is like tying a rope on the tube, the fallopian tube that is. Then this is the uterus, your cervix, vagina, blah blah blah. So basically this is it, and the other end. So this is ligation. You could get it clipped, you could get it cut off. Cutlery is you use some heat, it's using some instrument which use heat. You cut off the fallopian tube, sorry, so it's cut here, and then this part is ligated, this part is ligated. This is for permanent. Most of the time it's not reversible, but people say it can also be reversed, but most of the time it's not reversible. That's why it's normally on the permanent part, yeah? So let's talk about temporary. For temporary, we have plenty of different ways we could use. I would start with hormonal. Now, as we all know, we have different types of hormones in our bodies. There's the female hormones and then there's the male hormones. For female hormones, we have estrogen and progesterone. And for men, there's normally testosterone, but we're not going to be talking about the male hormones today. We're going to be talking about the female hormone. So I've not done the topic of the normal menstrual cycle, but when I talk about it, then I'll be able to explain to you how estrogen and progesterone play a factor in the whole menstrual cycle and babies and all that. So because these hormones are the ones that bring about either being able to conceive or not to conceive, or just get your menses normally. So for the hormonal, the drugs that are used use the same hormones, analogs of these hormones, to be able to come up with the same effect as if the body, to mimic some sort of, to give a sort of environment for the body to make it believe like it's almost like it's pregnant, but it's not pregnant, but so that you cannot get pregnant. I'll explain into details about each and every. So for the hormonal, we have pills. For pills, then it's divided, like there's progesterone only pill, just too long, only, and then there's combined. For combined, then you have estrogen plus progesterone. So for estrogen plus, this is the most commonly used, estrogen plus progesterone. Around here in Kenya, the one that is commonly distributed is called Femiplan. It's the one that is normally used so much. It's a combined sort of pill. So for this, it normally it mimics the cycle of a regular person. Normally you have 28 days for your menstrual cycle. And you're supposed to take this day, the pills from day 1 to day 21. Then you take a 7-day break. And then after that you start. So what is this day 1? Day 1 is the first day when you get your period. That is your first day of your cycle. So you start taking the pill. If you're starting it as a new regime, then you start taking it when your period starts. That is the day 1. And then you take it for the 21 days. It's marked on the whichever pills you'll be taking. Then for the 7 days, it's either you get just other pills which are like, maybe we call them placebo pills. It's like either iron, or sometimes you could just go pill free 7 days and then again. So basically, all the time, the first day that you'll start using the first cycle, and then the cycle keeps on repeating itself like that. So maybe then when the next time you're taking your pills, it will not be on the first day of your menstrual cycle, because now it will have changed the dynamics of how you're using your pills. But when you're starting, then you could start at this particular day. But sometimes if you actually really need to start the contraception really fast, then you could start it at any day that you wish to do. So we've done the combined, the progesterone only. Also, it exists in the same way. You take it for 21 days and then there's a free time. So for the 7 days free time, you normally have withdrawal bleeding. It should not scare you. You could just assume it's like your normal periods, because it will come from the 7 days, not necessarily on exactly the first day or the 7th day that your periods will start, or the withdrawal blood will come. But anytime from this day 7, you could have a few shedding of blood, which mimics the normal period, and it should not scare you or feel like there's anything wrong. So yes, we started with the pill. Second, there's injections. So with injections, you normally get it, and it's supposed to last for 3 months once you're given the injection, and within these 3 months you'll not be having your periods, and you could have spotting once in a while, so that should not scare you too. And for the injection, it's called Depo Provera. The other thing that could be used is I'll use it in a simple term so that you could understand, the coil, but the real name of this thing is called IUD, intrauterine IUD, intrauterine devices. So what happens is, for this you need to go to the hospital for it to be fixed. So they're coils which are hormonal, so which they emit the hormones inside when it's inserted into your vagina, and there are some which are copper. For the ones that are copper, the copper does not have any hormones, so basically it's the copper wire that acts to make your uterus hostile for implantation. So that's why it works like that. So fertilization cannot take place, actually the whole process of getting pregnant cannot take place, because the uterus has become hostile because of the copper. That is the mechanism of action for that. So we've done hormonal, let's do barrier. If I'm asked, and especially for married women, whom you think your marriage, pardon me to say that, but if you feel your marriage is one faithful union, and that the only thing you guys are trying to avoid is just pregnancy, then this, for me, I think this is the best method to use, especially the pills. But for the young ladies out there who feel, or the young guys who feel the need to engage in these activities, sexual activities, then the barrier method should be the #1 priority. Because the barrier method, not only does it help to prevent pregnancy, but also helps with prevention of STIs and other sexually related diseases. So what are barrier methods? There is condoms. There is male and female. These are not so common in my area, but then these are common. But whichever place you're from, if the female are the ones that are common, if the male are the ones that are common, you could do either. Still, you will have protect yourself against so many things other than just pregnancy. So there's condoms, and then there's diaphragms. So the diaphragms are like this. They're like cup shaped. You insert in the vagina directly in, so that it protects you. It protects from the sperms from ascending up during intercourse. But it's advised that you don't use the diaphragm alone. You try and use it with spermicides. So spermicides could be either spermicides. These are substances that are used to kill sperms. So they could either be in cream form, or they could also be available in foam form. So you could use either of that, but if you're using this, it's good if you combine it with this. So we've done hormonal, barrier. The other thing, this natural contraception. This, I only advise this for married people again, because at least when you have the institution of marriage, then you're not really scared of actually getting a baby, even if the finances could be a bit tight. So for the natural ways of contraception, there's the calendar system. And this calendar system can only be used with women who have actually been having regular menses and they know their dates well. So you could know when your safe days are and when your safe days are not. The day I'll be talking about the normal menstrual cycle, then it's when I'll explain to you guys when the safe days are and when the unsafe days are. The other thing is mucus method. Mucus method is the one that you check your mucus to see if your vaginal mucus, that is, to see on the consistency. If you can stretch it between your two fingers and it goes long like that, then that is not it's not the safest time to have intercourse. But if you try to stretch it out and it breaks in between your fingers before they actually reach this much, then it's safe. But then for the natural method, as I said, it's good for married people, because even if they have a kid, it's not going to be such of a big issue, according to what I believe. And the third one is withdrawal. So for withdrawal, or coitus interruptus, it's when you have the intercourse, you have it whichever way you want it. But then immediately the man is about to ejaculate, he withdraws from the vagina and actually does his ejaculation outside your area. So this is not so, for people who cannot control themselves, it's not so advisable to try this one. And then there's the other one, basal temperature. You keep on checking your temperature, not your axillary temperature, no, but like the core temperature. So I'm not really sure if most people could do this all the time, try to check their temperature just because they want to see, because during ovulation time is when your temperatures automatically go high. But again, for these natural methods, I'm not so much of a fan, and I would not try to encourage people to do it. So we've done barrier, we've done hormonal, we've done natural. So let's move forward then and talk about this non-contraceptive benefits of hormonal, the pills, where they combined. So for this, we have one, it reduces period pain. That's a good thing, yeah? 2, reduces menstrual flow. Another good thing. The other thing, it's been said to be protective against uterine and ovarian cancer. The other thing, it makes you know those moods we normally have when our periods are almost there, you feel like you don't want to do anything, you don't want to eat anything, you only want to eat some sort of food. So for that, those kind of symptoms and feeling moody, it also helps. PMSing, it helps reduce it at a very large percentage. So those are the non-contraceptive benefits of the hormonal, especially the combined pill. So up to now we've gotten how many? 4 non-contraceptive benefits. So for more on, because I still have lots of I need to discuss still on the hormonal and the barrier and the natural. There's so many stuff that is coming up and is going to be. Please join me in part 2 of the same contraceptive and fertility control, so that we can finish up this topic and wrap it good.